think, early on in the biggest misconception is that Medicare is bad health insurance, right?
Oh,
I mean, people, I feel like they think of government and they think of like Medicaid, or they think of just the horror stories that they hear. And so they assume that Medicare is not going to be good health insurance. They assume they're going to get some not great doctor that's going to cost them a lot of money. And so people sometimes even delay retirement because they're scared of being on Medicare. So they want to hold on to that employer health insurance as long as they can. But that's a huge misconception.
Welcome to Absolute Trust Talk with your host, Kirsten Howe. Absolute Trust Talk brings you tips, tools, advice, and interviews to help you build a reliable knowledge base on estate planning, business, and finance to start preparing for your future today.
hello and welcome to Absolute Trust Talk. I am Kirsten Howe, and this is another Facebook Live version of our podcast at Absolute Trust Council. I'm so glad you're here today. We're going to be talking about Medicare planning and sort of the things that you need to know when you're thinking it's about time for you to sign up for Medicare. And this is such an important topic. I have so many clients who are in that bracket, that age group approaching 65. And if they're anything like me, they really don't know what they need to know. And so I was just so excited to be able to get Emily, my guest, on the show. She's really going to help walk us through what we need to know, what we don't know. Many people assume that when they turn 65, they are automatically covered by Medicare and that everything's going to be paid for. And that is not true. There are lots of things you need to know. And my guest is going to help enlighten us all, myself included. I'm going to introduce her officially in just a second, but I do need to get a couple of housekeeping items out of the way. So if you have a question that you would like to ask Emily as you're watching, go ahead and type it in the comment section on Facebook, and I will ask those questions at the end. If you're not watching live, I'm sorry to say we can't answer your question, but if you're watching live, that's one of the perks that you get for being a faithful viewer. All right, so my guest today, Emily Gang, has changed the way people make their Medicare decisions. Her company, the Medicare Coach, is a fee-based, independent, that's an important word, Medicare expert. And Emily and her team help thousands of people navigate Medicare rules and insurance company confusion to help them make the right Medicare decisions to protect their healthcare rights. And this is important, their retirement savings, because I understand that a mistake can cost you a lot of money. Emily has combined her 7 years of experience at Goldman Sachs and her passion for helping people to revolutionize really the way people make Medicare decisions and to help people save time and money. Emily, thank you so much for being here. I can't tell you how excited I am about this episode in particular.
Well, thanks so much for having me. It's really my pleasure. So yeah,
Great.
it's funny because, as to that introduction, Kirsten, people look at me and they say, but you're not old enough to know anything about Medicare, right? And I get that a lot. I mean, I'm 37, but, I kind of stumbled across this when my parents were turning 65. I mean, as you mentioned, right, I was at Goldman and I thought I knew everything about financial planning and investing and everything that kind of goes into retirement. And then I was home with my parents one time and the phone at dinner was ringing off the hook. I had no idea what was going on. And my dad explained to me it was Medicare. And I was baffled at just the way that Medicare is done in our country. And so we actually found the Medicare Coach to help my dad. And we're glad that we did, because the plan that I would have picked for him would have been the wrong plan. And then I joined them a few years ago, almost 5 years ago now, to really kind of carry on this legacy and help more people. So it's really my pleasure to be here with you, Kirsten. I love Medicare. It's such an important one. And so I look forward to answering both your questions and all the viewers as well. So looking forward to this.
Okay. So what would you say is the biggest misconception that people have about Medicare?
So I think that, early on in the biggest misconception is that Medicare is bad health insurance, right?
Oh.
I mean, people, I feel like they think of government and they think of like Medicaid, or they think of just the horror stories that they hear. And so they assume that Medicare is not going to be good health insurance. They assume they're going to get some not great doctor that's going to cost them a lot of money. And so people sometimes even delay retirement because they're scared of being on Medicare. So they want to hold on to that employer health insurance as long as they can. But that's a huge misconception because look, there are some very bad plans out there. And I shouldn't say bad. There are plans that do not fit you as an individual, right? But Medicare can be great when you go into it the right way. You're thoughtful and informed about your decision, and you really are strategic in how you pick. So again, that is the biggest misconception, I think, early on. I mean, have you ever heard people talking about, being scared of Medicare or the cost or the coverage, or have you ever?
Oh, sure. Yeah. I think I don't dabble in Medicare the way you do. I mean, I don't have that depth of knowledge, so I'm not in it every day. But yes, I do hear that similar, it's government healthcare, that can't be good.
Yeah.
Can't be good. And that's interesting. But so the thing that I said in my sort of lead into this episode was that people, I think, assume that all you got to do is turn 65 and bam, you're covered and that's it. But that isn't true. There are decisions you have to make. Am I right?
That is correct.
So
yeah.
What are examples of some of the decisions that people actually have to make?
Yeah. So good question. So, and I don't want to go into too many details here, but at a high level, there's really two programs that can cover you when it comes to Medicare. There's kind of this traditional Medicare route with a Medigap plan, and the other side is Medicare Advantage. So the path that you go down depends on you. And I know we were talking before this, Kirsten, but in my opinion, it comes down to a few factors. And usually the most important factor to decide which program and plan that you want is what type of medical care do you want, right? Which doctors do you want to see? What costs do you want? How do they cover your medications? I know in California, right, Kaiser is a big provider.
Yeah.
And Kaiser only accepts Medicare Advantage plans. Okay. So I had a client, John, who is in California. He's just north of San Francisco. And he was trying to figure out what to do with Medicare. And he goes, Emily, I don't know what to do. And so I kind of walked through the process and I said, well, John, which doctors do you want to be able to see? And he goes, I am at Kaiser. I want to stay with Kaiser. And I said, John, that's great, right? You can stay with Kaiser if you want to. But I just want to let you know, by going to Kaiser, you're going down this Medicare Advantage route. And because of how that works and how their networks work, right, you might not be able to go to, say, any of the university hospitals in California or a Mayo Clinic or an MD Anderson, or by him opting into that Kaiser Medicare Advantage plan, he is giving up other optionality. And so that can be a little tricky. And I say that because, and I don't want to get into too many details here, but there are insurability rules that can make it hard to switch plans later on. And so there's things we need to be thoughtful about going into Medicare, because the decision that you make when you first join Medicare might be the one that you have for the rest of your life. So again, I feel like in California, you either love Kaiser or you hate Kaiser. And I'm not here to tell you which boat to be in, right?
Right.
But it does work differently in terms of how Medicare at Kaiser works versus how Medicare works at other facilities as well. Does that make sense?
Yeah, that does. And you are right. Kaiser is very polarizing. You're either, you love it, you will never even consider doing something else, or you're happy to get off of Kaiser. You're tired, you're done. But that is interesting to know that, you make that Kaiser choice, this is what's available to you. You're limited to this Medicare Advantage plan if you want to stay within the Kaiser system. So that's interesting to know. What are biggest mistake that people make when they're signing themselves up for Medicare?
I think it goes back to this insurability thing, right? A lot of people they're 65, they're healthy. They just pick a plan that they've seen on a commercial or pick a plan that is cheap or whatever it is. And they just assume that they can switch plans later, right? And it goes to kind of that Kaiser example. But I mean, I have an example of a daughter in Texas who contacted me. Her father had cancer. He went to their primary care provider and he decided he wanted to go to MD Anderson. But he went to go book an appointment at MD Anderson and found out that his doctor does not accept his Medicare plan, right? MD Anderson did not take his plan. And so they had to decide, one, do they just stay with a in-network, right, oncologist that's good enough? Or do they pay for MD Anderson and pay for at least a bit of it out of their own pocket, right? Which can be expensive, especially when you're talking about cancer or other serious illnesses. The biggest mistake, again, like when people are actually officially signing up for Medicare, is around understanding what their options are in the future, right? You can switch plans as long as you're healthy, right? But once you become unhealthy, you can't just go anywhere. And so being thoughtful about making that decision when you first
in the
join.
beginning. Yeah.
Because I mean, I get contacted all the time by people and they're, they've been on Medicare for a couple years and it's a mess and they want my help. And at that point, we can't do anything. Like, I'm all about finding every rule that can help, right, clients navigate Medicare to their advantage, but there aren't always rules that exist and have to happen what they want to have happen. So being thoughtful at 65, even though I know we all think that we're invincible at every age, right? I think it's just important to be thoughtful about that. So,
Right.
Yeah.
That is such an interesting point. And I'm going to admit, I don't have a problem admitting how stupid I am about some things. I'm going to admit that I didn't realize insurability was still an issue. I guess I assumed, you're on Medicare.
Yep.
What the heck difference does it make if you have a pre-existing condition? We'll just use that terminology. But it does.
Yeah. I mean, the ACA has kind of put out this news right around insurability rules in general. So that's what we've really heard through kind of our news sources. Right. And again, there's a lot of pieces of Medicare that we just can't get into now, but Medicare Advantage, you can switch those plans every year from October 15th through December 7th. They kind of have to allow you to change plans. There's another window as well, but that's the main time. But the important one that you can't get into are the Medigap plans. Those are the ones that they can ask you for your health history before you join. And the thing is, when people get sick, they almost always want to be on one of those Medigap plans. It usually provides the most coverage at the lowest cost. And so that's the switch that can't always happen
whenever you feel like it. Yeah.
Exactly.
So just for our listeners, meaning me, give me generally what you mean when you say Medigap. What are we talking about there?
Yeah. So, there's two main parts of Medicare. There's Medicare Part A, which is your hospital insurance, and it's not used all that much, right? It's an inpatient hospital stays, hospice, skilled nursing, things like that. But Medicare Part B is what people mainly use, right? It's for your doctor's visits.
When you go to the doctor.
Yeah, it's all of that.
And your labs and all that stuff.
Exactly. And the thing is, Medicare Part B only covers 80% of the approved costs. So there's no maximum out of pocket on Part B. It's just you pay 20%. So if you
$1 million times 20%.
It's you if you don't have a Medigap plan. So that Medigap plan is what's really important to kind of protect your savings. And there are lots of letters. There's A through N to pick from. So it can be very overwhelming and different letters fit different people for different reasons. But that Medigap plan is important, right? So that you're not stuck with that 20% of all your medical bills, which I feel like, I had a herniated disc a few months ago, and just the bills from that, I was shocked at what an MRI is, or even a doctor's visit, or anything. You have any little, and I feel like I'm healthy, but any little thing that comes up, and it gets expensive fast. And so those Medigap plans really protect that retirement savings, right? We spend basically our whole lives planning for retirement, saving that money, running those projections of investment returns and putting in estate planning, all these things to protect us. But if people don't have that one last piece of Medicare kind of buttoned up, it can unravel the rest of it.
The whole thing that you've been doing for 40 years. Yeah.
Exactly.
That is such good advice. Okay, so we've been talking about what people who are thinking about, it's getting close to time for me to sign myself up for Medicare. Well, and you, in your company, you actually have a process where you walk people through the things that they have to think about. You're not telling them which plan to choose, but you're just highlighting the things they need to think about in order to choose correctly, because it's different for everybody.
Right.
Every single person is different.
It is different. And again, to your point earlier, people just assume that Medicare is all the same, and it's not, right? We'll have clients. So we will take our clients from the very beginning to the very end. And that's different for everyone. Many people are joining Medicare at 65. We will take them through all the processes, the questions to ask their doctors, and we will make some recommendations on plans and companies to pick if that's what they want. But I don't know about you, Kirsten, but more and more people are working past 65, right?
Oh, sure.
And so, I see a lot of 65-year-olds who go to different sources and they're kind of told, well, you're 65, you have to be on Medicare. And that's
not true.
Not always the case.
If you're still working, you are allowed to not join Medicare.
If you have an employer health insurance plan that meets Medicare rules, you can delay. So it can be your employer or even a spouse's employer. And so there's different ways to look at it, but the government's main goal is that you just have health insurance, right? Medicare was created because back in the day, people 65 and over were not being insured. And so it was a chance to ensure that people as they age get health insurance. And so the government doesn't really care where you get it from as long as it's a good health plan, right? I will say COBRA doesn't meet Medicare rules. The ACA doesn't meet Medicare rules. There are things like that that don't really, like VA coverage does it. So there's some nuances. Okay. But as people work, the Medicare advice that we might give them is to delay Medicare, right? Uh-huh. But with that said, we also have clients who pay a lot of money on their employer plan, and it's cheaper for them to join Medicare.
Just join Medicare.
So there's never like a black and white solution. I think it's sometimes my frustration with how most Medicare is done. It's like very black and white, like you do this or you do that. And I just think that there's a lot of gray lines that if you want to look at it appropriately, you should be thoughtful about it.
Okay. So I guess maybe what I'm hearing you say is that even if you are getting close to 65 and your intention is to continue working and you have employer coverage, it's a good idea to still talk to somebody like you and make sure your employer coverage qualifies you because I'm guessing if you're supposed to sign up for Medicare and you don't sign up on time, you could get in trouble for that too.
That's correct.
Yeah.
But
because they want everybody in the pool.
Correct. They want everyone covered. So there is a timing. I think what frustrates me is that all of the statements that come from Social Security say you must join Medicare or you may face penalties. So that's a pretty daunting claim that they have, right? But that's a big may. There's a lot in that may face penalties. So I had a gentleman who was in San Francisco who he was 67. So he kept working till 67 to cover his wife who was younger. And then once she was 65, they retired. But at 65, while he was still working, he kept seeing all of these advertisements, these mailers from different sources, and he just assumed that he had to get Medicare. So he had his employer plan, he got Medicare Part A, Medicare Part B, and he thought, well, what the heck? I'll just get a free Medicare Advantage plan. I have nothing to lose by that. Well, those decisions made it an absolute nightmare for him when he eventually wanted to fully join Medicare because he had his clock start at 65 by enrolling in certain things, and he shouldn't have. And so it was a mess kind of undoing that. We couldn't undo all of it. But when people just think that they're doing the right thing, like, oh, I can afford the premium, like, what does it matter? It can be detrimental later on too. And so people try to do the right thing and then it's not always the right thing. So, and that's what's the hard part.
Some of these decisions are irretrievable. So make it correctly the first time around. Make sure you know what you're doing. Yeah. I think that's like the message of today. Make sure you know what you're doing. So Emily, I know that you have webinars, they're just free webinars. People can go on your website and get this free information. TheMedicareCoach.com.
Yep.
TheMedicareCoach.com. And you also, they can hire you to get really individualized, customized help with doing this. So how often are the webinars?
So I currently do the webinars twice a week.
Okay. Yep. All right. So everybody should be doing that.
Yeah. And people I've been told multiple times it's been better than even their HR department has given them. So it's a great place to come to really walk through those steps of Medicare to just make it simple. If you want to join, it's a great place to get started and at least dip your toe, whether for yourself or for a family member or anyone else who might enjoy it. So
Right. I think that is such a great service that you offer. And I'm going to do one myself. I'm going to sign myself up for one of your webinars because I know it's shocking, but Medicare is not too far away for me either. So going to get educated. All right. One last question. People who are already on Medicare. Now, we've been kind of focused on people who are about to turn 65, but the people who are already on Medicare, what should they be doing?
Yeah, a good question. So if they are healthy, if they have no health history, they can make changes to their plan. Most of those changes will happen from October 15th through December 7th. But if people are very healthy, right, no crazy, no real medications at all, no health issues, they can change plans if they want to in that period. If you do have health issues, it can be even as, antidepressant medicine, heart medicine, a weird, like I would be uninsurable right now with my back. If you're uninsurable, there's still some changes that you can make in that October 15th through December 7th period. And the main one is around your medications. Most people who take medications, there are huge changes every year from the prescription drug plans that can make the costs very big. And so they're adding and dropping pharmacies, they're changing the code, they're changing the tier of the medication. They just change a little bit of everything. And so I do recommend that everyone reviews their Part D drug coverage from October 15th through December 7th. I just got this like angry message that popped up. So maybe it's the pharmaceutical companies telling me not to tell you all of our secrets to save you guys a lot of money.
They're listening too.
Yeah, totally.
Yeah.
Totally. So anyway, just reviewing those drug plans, especially, is always important as well. So
you could be going along just fine. The medication that you need to take is comfortably priced for you, and something could change in your coverage that all of a sudden, wow, I don't think I can afford that anymore.
Yeah.
So you can take a look at that and maybe make an adjustment.
Yeah. They're required by October 1st to send all the new plan details out, but that booklet is so big that most people don't ever get through. And our average client saves around $1,000 a year by changing Part D drug plans. And it can be simple drugs. I mean, generics don't usually have a huge change, but I have a family friend who's a client as well, and he's on a heart medication, and he saved $4,000 just by having us change his plan.
Part D. Wow.
Yeah. So there's little things like that can definitely add up.
Okay. I hope that is a nugget that is going to be well worth what I paid you to come on the show.
Yeah.
I don't pay.
Yeah.
Just so people know. But no, thank you for that. That was really great. All right. I'm going to turn to our audience questions because I don't want to take too much of Emily's time. I don't want to abuse her generosity. Oh, so we're talking about Part D, which is the prescription drug. Is supplement the right word for that plan? Is that a supplemental plan?
So just on a summary, there's Medicare Part A, which is hospital. There's Medicare Part B, which is your medical. Medicare Part C is Medicare Advantage. Medicare Part D is your drug coverage. And then there's Medigap. So there's kind of those different parts.
All right. Okay. Yeah. So here's my question. If you are not taking any prescription drugs, can you skip enrolling in a Part D plan?
Yeah.
And add it later on?
Good question. So technically, yes. You do not have to get a Medicare Part D drug plan.
Part D is optional. Okay.
Well, it's not optional. You can choose, but if you don't have creditable drug coverage, you'll be penalized. Now, the penalties aren't huge. They're not as big as the other Medicare penalties, but there's still a penalty there. And so there are times when I do recommend that clients take the penalty, and it's usually when they have a really high income. Medicare also has high income penalties. And so if they have a really high income, they're paying a lot for their Part D high income penalty, and they take no medications, it might make sense not to get a drug plan. But usually I would say, well, it is kind of optional. Not really.
Kind of optional, yeah.
It's usually just better off to get it. You can just get a cheap drug plan to avoid those penalties.
Okay.
But if you don't join a plan when you first join, you can join a plan from October 15th through December 7th. That would start January 1st.
Okay.
Yeah.
Okay. So here's another question. When should I start preparing to sign up for Medicare? I guess maybe like how long before my 65th birthday should I get going on this?
Good question. I feel like 64 is kind of the main start date. Again, ideally people come to us ideally the 9-month mark, 9 to 12 months before they join Medicare. With that said, I mean, there are things so that's like kind of the prime time for Medicare. With that said, before you join Medicare, know that your income decisions that you're making before 65 can impact what you pay at 65. So I had a client, Jane, who she went through a divorce and she took money out of her retirement account to buy a new condo. Well, so
she had a big income. Yeah.
And so there are things just to be kind of thoughtful about when it comes. And look, sometimes you might not be able to avoid it, right? But I at least like to be thoughtful about things rather than just be surprised. And so I think the prime time is really 64 at your 64th birthday. But there are a few things in advance that you can be thoughtful about as well to just not have any total nightmares once you join Medicare, or easy to avoid mistakes.
Got it. Okay. All right. Here's another question. Does Medicare cover healthcare expenses outside of the U.S. or are there supplemental policies available to cover that?
Yeah, good question. So Medicare will cover medical emergencies outside of the U.S. and its territories. So if it's a true emergency, so like being in a car accident, having to go to the hospital, that's an emergency. A sinus infection, food poisoning, a broken ankle, not a medical emergency.
Oh, okay. It's more like in the life and death category.
Yeah. But that's how a lot of our employer health insurance is as well, right? It's not that different from what most of us are used to. I will say, some people want to get travel insurance, and that's great. But I also am a little sad when people get travel insurance. It covers the things that their current health care already covers. So if you're just getting an emergency plan overseas, unless it's, including an airlift, let's say, it doesn't really add any extra value. Yeah.
Okay. And then, so I think what you're saying is if you are an American who has chosen to live in another country, you got to figure out something else for your healthcare. It's not going to be Medicare.
Yes, but we have clients, and I think we're at 10 or 11 different countries now. And the question is, what do you want your American healthcare to be, right? So I have a client in Spain who says, well, I want to come back to my doctors every quarter. Okay, great. Well, you should probably just have full-blown Medicare. But I have other clients in, say, Costa Rica, and this gentleman said, well, I only want to come back if I have cancer, right? And so it's depending on what you want, depends on what you need. I also have dual citizens I have a dual citizen right now of Canada and the US. And it's like, well, there are ways to kind of combine the two to get the benefits, but this is definitely a gray area, Kirsten, in terms of it just depends. But there are ways that you can use Medicare, and you really should meet Medicare rules if you want to use it in the future.
Okay. I have one last question, which I think you might have answered, but honestly, I am not sure. So I'll ask it. If you have a Medicare Advantage plan, can you switch to a regular Medicare plan at any point?
So you can technically go back to original Medicare, basic Part A and Part B. You can also get that Part D drug plan, but the thing that you might not be able to get is that Medigap plan.
Because of the insurability issue. Yeah. Okay. Wow. It's a lot.
It is, but I also believe that once you have this thing set up, if you do it right the first time, it's somewhat on autopilot, right? But it's about getting into that right place, being thoughtful about it, and then it can work. But it's not the same as our employer health insurance, despite what it might look like on the outside.
Okay. All right. Well, I'm just going to reiterate. I think there just is so much that the average person doesn't understand. And this is such an important decision that we have to make. We really need to understand it. And thank you, Emily, for everything that you've got. You've got the webinars. People can actually work directly with you and get help. And thank you so much for being here. I can't tell you how informative and helpful this has been, I think, for my listeners and for me too.
It was my pleasure. So thank you again for the opportunity, Kirsten.
You are welcome. Thank you. All right. I hope you got even a tenth of what I got out of that interview. That was just fantastic. I really appreciate you being here. I'm glad you were here to see this and listen to it. And I hope you learned something that's useful to you. If you like our podcast, be sure to go to iTunes and subscribe to our podcast. That helps us. All you have to do is click on that purple button on your phone and type in the words Absolute Trust Talk, or you can type in my name and you will find our podcast, and then you subscribe, and then you won't miss any episodes. That helps us with our SEO and all of that kind of stuff that's important to business owners. Besides searching for us on iTunes, you can always find all our episodes on our website, absolutetrustcouncil.com. There's all kinds of stuff there, newsletters, blogs, podcasts, videos, lots of resources. So I hope you take advantage and help yourself to anything that you might find that's useful there. Also, make sure to catch our next episode. We'll be in a couple of weeks again live here on Facebook. I know you'll get a lot out of that one too. And until then, I look forward to connecting with you next time, and stay safe and healthy.
Thank you so much for listening today. I really appreciate you being here. I am so grateful that you're in my audience, and I hope you also learned something and enjoyed the show. If you like our podcast, be sure to go to iTunes and subscribe. You just type the words Absolute Trust Talk in the search bar on your podcast button on your phone, and our podcast will come up and you'll be able to subscribe there. That subscription helps us with our visibility online, our SEO, and all those kinds of things that I never understand, but I'm told that it's important. So in addition to searching for us on iTunes on your phone, you can also just go to our website and you'll find our podcast there. You'll also find all of our previous episodes. So you go to absolutetrustcouncil.com, click on the podcast tab on our homepage, and you'll see all the topic for all of our previous guests, and you just click on the one you want to listen to. Also, make sure to catch our next episode, which will be out in a month or so after this one, and I know you'll get a lot out of that one too. So I look forward to connecting with you next time.
Thank you for listening to Absolute Trust Talk. If you loved this episode, head on over to iTunes to subscribe and leave us a review. Don't forget to visit our website, absolutetrustcouncil.com, where you can find a host of guidebooks and other tools to help you through the estate planning and estate administration process. If you need help securing your own legacy, then put your absolute trust in us. Give us a call at 925-943-2740 or email us at info@absolutetrustcouncil.com to set up your free consultation today.
This podcast is not meant to take the place of legal advice from an attorney and does not create an attorney-client relationship. If you do have a legal question or issue, please consult with an attorney.